This DVD will demonstrate to the student how to perform a quality electrocardiograph tracing and the techniques to eliminate artifact. An ECG records the electrical impulses as they move over the heart muscle. These impulses regulate the opening and the closing of the chambers of the heart and the passage of the blood through the chambers. If there is an interruption to the sequence of these impulses, this will be seen on the ECG or electrocardiograph. An abnormal sequence of the impulses could indicate to the physician that there may be damage to that part of the heart muscle. The electrical activity that occurs during a cardiac cycle can be recorded on an electrocardiogram, or ECG. When the heart muscle contracts, there is a change in the electrical potential across the membrane of the muscle fibres. As body fluids and tissues are good conductors of electricity, the electrical changes that occur in the contracting myocardium of the heart can be detected by attaching conductors to a person's arms, legs and chest. All of this is measured via the ECG. A normal ECG shows 5 waves that are named P, Q, R, S and T. What is measured or can be detected on the ECG? The underlying rate and rhythm mechanism of the heart, the orientation of the heart or how it is placed in the chest cavity, evidence of increased thickness, hypertrophy of the heart muscle, evidence of damage to the various parts of the heart muscle, evidence of acutely impaired blood flow to the heart muscle, and patterns of abnormal electrical activity that may predispose the patient to an abnormal cardiac rhythm or other disturbances. By examining the pattern of waves and the time interval between them, the physician can assess information about the state of the myocardium and the conducting system within the heart. Some important signals to note during an ECG include the time intervals between different phases of the cardiac cycle and the size of the electrical signals.
Good morning. Doctor has requested that we perform an electrocardiogram today, otherwise known as an ECG. This is a simple tracing of your heart muscle. It involves me sticking some electrodes on your chest, your wrists and your ankles, laying up on the bed for a short amount of time. Before we get started, I'll need to obtain your height and weight. I'll need to get you to remove everything heavy from your pockets, take your shoes off and step onto the scales for me.
Okay.
Okay, the first thing I need to get you to do is just standing flat against the wall with your heels up against it. Fantastic. Looking straight ahead. Okay, 182. Fantastic. Just step onto the scales for me. I'll just get you to pop behind the curtain, remove all your garments from your waist up, hop up on the bed and place the blanket over you. Are you comfortable and warm?
Yes, thanks.
The collector must explain the procedure to the client to ensure that they are not nervous, because a nervous or cold patient could result in the ECG reading being inaccurate. Explain to the patient that the procedure will not take long and it will not hurt. They must refrain from talking and moving whilst the recording is taking place. And it is imperative that the electrodes are placed in the correct positions and the leads on the correct electrodes. Skin preparation is also vitally important. Shave hairy patients and remove any powder or skin creams with soap and water only. Attach the chest leads in the following positions. V2, 4th intercostal space at the left sternal bone on the left side of the chest between the 4th and 5th rib. V1, 4th intercostal space at the right sternal bone, that is, on the right side of the chest between the 4th and 5th rib. V4, 5th intercostal space in the left midclavicular line on the left side of the chest between the 5th and 6th rib, directly under the middle of the clavicle bone. V3, equally distant between V2 and V4, that is, in the middle of these two leads. V6, mid-axillary line in the same horizontal plane as V4, again next to V5 but still further over in line with the armpit. V5, Anterior axillary line in the same horizontal plane as V4, next to V4 but further over in line with the armpit.
I'm just going to place 2 on your wrists now. Okay. Excellent. Place your leads on the electrodes now. There is a simple and quick check the collector can use to ensure the leads are in a correct position. Check the AVR lead has a downward deflection of the wave. The lead 1 waves will be seen to have an upward wave. Are you comfortable and warm?
Yes, thanks.
I'm just going to remove the leads now. The test is finished, okay?
Thank you.
Take the electrodes off. They may be a bit sticky. Now that everything's removed, you're free to go. I'll just place the blanket up. You're right to get dressed and leave.
Thank you.
The ECG is mounted in the following sequence: leads 1, 2 and 3, AVR, AVL, AVF, V1, V2, V3, then V4, V5, V6 and the long lead 2. Performing an ECG on a baby or child is exactly the same as an adult, only scaled down to the appropriate size. The trick with children is encouraging them to be still whilst the procedure is happening. Ensure that a baby has just been fed and comfortable, and explain the procedure thoroughly to children so they are not afraid.
Hey. Hello. Hello. You're very cute. Hey.
You should just pacify her now.
You can talk? No.
She could. She would if she had a milk. no, don't cry.
Little grunter. Oh, sorry,
Stop it. Yeah, see? It's not that bad.
That's actually a pretty good one. Yeah.
You're telling stories. You're telling stories. Yeah. Oh, yes you are. You're telling mummy stories. Yeah, I know.
She's happy now.
Better. See? You've got it.
Hello.
It is essential to eliminate artifacts before recording the ECG. Poor technical recordings create blurred, fuzzy waveforms that are difficult to read and measure. Attention to the following details will ensure against artifacts and poor recordings. The patient must lie on a comfortable bed large enough to support the entire body. They must be completely relaxed, and this can be achieved by a thorough explanation of the procedure to relieve any fears or apprehension they may be experiencing. Skin preparation is vitally important. Poor skin preparation and electrode contact will result in a poor tracing. Hairy skin must be shaved.
Before we get started, I'll need to get you to remove everything heavy from your pockets.
If you follow the guidelines of this DVD and your manual, you'll be ensured of a quality tracing that will be easily interpreted by the physician.